What if there is an intervention that impacted every single one of the patients that you see daily in your clinic? What if that intervention could provide relief for some of the most challenging patients you see? What if your patients with balance problems, dizziness, respiratory disease, chronic pain, people with post-concussion syndrome, neurodegenerative diseases such as Alzheimer's and Parkinson's, what if all of these people could be dramatically impacted by an intervention that we at Fyzical have been working on? Well, I'm happy to say that such an intervention actually exists. Hello, my name is Herb Silver, and I'm a Fyzical franchisee in Marietta, Georgia. Fyzical formed a study group to develop protocols for treating clients recovering from COVID, which we did. Quite unexpectedly, one of the things that came out of this was learning about what one of our franchisees, Denise Campbell, has been doing for the past 15 years. She's been using capnography that measures exhaled CO2 as a biofeedback technique to enhance breathing. Some of you in sports medicine and working on sports performance may already be aware that the next great thing in sports is breathing. What many clinicians haven't come to realize is the very same intervention that can make you run or swim faster can also improve your brain function, improve your sleep, reduce chronic pain, and a host of other things we encounter every day. Again, let me tell you, this is huge. But briefly, let me explain why this might be true. Personally, as a runner, I have been very frustrated with my breathing. I can run just fine, but my heart rate goes up too high, breathing too fast. I can keep going, but I've always known something wasn't right. I've been a yoga practitioner for almost more than 50 years. I'm 64 years old. I started when I was 14 years old, so yeah, that's 50 years. And I decided that last year in 2019, I'd go back to some of those breathing techniques I had learned in yoga and try to understand what they might do. I knew that I had done them in the past. They did something. I really wasn't sure what. I became very frustrated with it again, as I have over the decades. And then COVID hit, quarantine, formed the study group, etc. Lo and behold, miraculously, I think, I learned about capnography. So the question is why would all these patients that we're dealing with, why would this make a difference? So let's just very briefly, let's start at the periphery. Trigger points, painful area in muscles. What we know is that these areas are hypoxic. It's been reproduced in many studies. They're too acidic. They build up hydrogen ions, various acidic chemicals in the muscle. That restricts blood flow to the area. The capillaries are occluded, and you have lack of blood flow in the areas hypoxic. Similarly, if you look at the brain with a lot of our patients with chronic pain, anxiety, depression, sleep problems, post-concussion, dizziness, the list is your whole list of patients. Look at all of these people. Functional MRIs show changes in blood flow to different areas of the brain, and various areas of the brain are hypoxic, lacking oxygen. It's kind of baffling if you think about it. We've been measuring everyone that walks in our clinic to see what their pulse ox is, and we find that everyone has pretty much normal oxygen in the blood. Why can't that darn oxygen molecule, why can't it find its way into our muscles, into our brain? Well, capnography tells you the whole story. And the whole story is based on a formula we all learned probably in pre-physical therapy, but we reviewed it as well in physical therapy programs. It's called the Bohr effect. And the Bohr effect has to do with how oxygen disassociates from the blood and goes into our tissues, brain, heart, muscles, and it does this based on the acidity of the blood. We all learned this. We could draw an oxygen dissociation curve, or we knew what it was when we looked at it, and we promptly forgot about it. I've asked numbers of doctors about the Bohr effect. I've asked a number of physical therapists. Most people remember it. Yeah, I learned that. What's it mean? Passed the test, moved on, forgot about it. Because one of the problems, and the major problem as far as what we're doing, is it discusses the acidity of the blood, which we can't measure, but the acidity of the blood quite quickly is determined by our breathing, very specifically how much CO2 we retain in our blood, which elevates the acidity of our blood to an ideal level, which is between 35 millimeters of mercury and 40 millimeters of exhaled CO2. So when we're breathing through this cannula and using a capnograph to measure our exhaled CO2, that it directly correlates with what's going on in our blood. What I found, and what you will find, and what many people are finding throughout the world, is that people who are hypocapnic, meaning they have low levels of CO2 in their blood, meaning that their blood is too alkaline, meaning that they have oxygen attached to their red blood cells, but because their blood is too alkaline, oxygen doesn't disassociate, leave the red blood cell, go into the muscles and brain. Seems simple on one level. I'll tell you personally, it was complicated because, in my mind, I'm thinking I want to breathe in more oxygen and get rid of that toxic CO2. That is far, far, far from the whole story. We need to retain a certain level of CO2. CO2 is a vasodilator, has antiviral, antibacterial properties, dilates. If you retain CO2 in your lungs, it dilates your alveoli, makes you breathe a lot better, your sinuses open up. It's really quite profound. But when that happens, and you get your balance right in your blood, which again, you can measure with a capnograph. When that happens, blood is going into your muscles, trigger points are going away, you're sleeping better, not as anxious, you're running better, all levels of performance increase. It's as simple as that. So sometimes what it helps to use a capnograph is we're able to better define what breathing techniques work for which patients. We're able to bring to the physical family things that they can use, whether they use a capnograph or not, how breathing actually changes the chemistry in your blood in a positive way. And at a very basic level, you can use what we're learning and what we'll be presenting to enhance your treatment of patients across the board. So I want to invite you to join us in this path of discovery and learning about the blood compositions, the relative levels of CO2, how it affects oxygen dissociation, how you can use it in your clinic to enhance patient care. And that's what we'll be presenting. Thank you very much for your time.